Is cancer a death sentence? Discuss. Let's start with you, Dr. Aisha.
Thank you very much.
Yeah.
Cancer is not a death sentence, and I will probably reiterate that cancer is not a death sentence. And the earlier we begin to propagate that cancer is not a death sentence, I think the better for everyone. The reason is because, yes, cancer is very difficult to manage. Cancer is something that is a life-changing diagnosis, but people survive cancer and people die of cancer, just like other chronic illnesses. And some cancers are definitely more aggressive than others. And it also depends on the type of cancer, the stage the cancer was discovered, the type of treatments available for that cancer, the type of treatments the patients can tolerate, the type of treatment the patients can afford. But largely, as Dr. Abdulazeez rightly said, is very good not to give the caveats because people tend to hold on to the caveats. Cancer is not a death sentence. And the reason I'm emphasizing this is because in my practice, I see lots of people who have a cancer diagnosis and they don't even seek help. They don't seek treatment because they just think the end has come. And then that is what will make the patient deteriorate and die rather than because he did not seek for help. So cancer is not a death sentence, if that is the take home from this. Yeah.
Thank you very much, Dr. Aisha. Thank you. Dr. Abdulazeez.
I'm terribly sorry to jump in here, and it's the last time I will interrupt. You know, I speak as a medical oncologist now, and there's different kinds of oncologists. So oncologists are people who treat cancer, specialists who treat cancer. You can have surgical oncologists like Aisha, who does a very good job of treating patients with operations, and they do most of the curing of cancer. So we're very jealous, those of us who are medical oncologists. There are people who treat cancers with radiation, which is strong X-ray treatments. They also cure quite a lot of cancers. And then there's people like me who treat cancer with drugs. So we tend to exist in the spectrum where we treat patients where this cancer has quite often spread to other organs of the body. And that means that we need a treatment that goes everywhere in the form of drugs to treat cancer. We're engaged in the curative treatments as well, but we tend to live in the spectrum of the non-curable side of cancer. Now, I'm going to agree 100% that cancer is not a death sentence, and cancer is curable. Not in all cases, but just like any other disease, it is curable a lot of the time. But even in situations where we cannot talk in terms of a cure, there's lots of treatments that are available that will not only extend life, and extend life, philosophically, Islamically, is a questionable thing, because how long did you know the life was to start with before you said you extended it? But secondly, improve quality of life, and that's a very important part. Having treatment that's going to minimize the suffering over time. That's an important part of cancer treatment. And I'm going to finish this with a personal perspective. I trained at the University of Ibadan. That's where I went to medical school quite a few years ago now. And at the time, I had the impression that cancer was a death sentence. In fact, I tell you that I never knew of anyone who was a cancer survivor. Even up to the time I finished medical school, I did housemanship. And then I moved to the UK for research. I moved to the UK to do a master's doing cancer biology. And when I moved into clinical medicine, I started to see more and more patients who had a previous history of cancer. And it then became clear to me that there were so many things that we could do to treat cancers. There was so much, it was so often that cancers could be cured. For instance, one of the most common kinds of cancer is breast cancer. And I was amazed to realize that 75% of breast cancer diagnoses, 75 to 80% of breast cancer diagnoses in the UK are cured. That is the reason I'm a medical oncologist today. because I went from thinking that something was a death sentence to realizing that there's a lot that medical science can do for these patients. And it was a big thing that spurred what I do today. And that is the reason that I joined the British Nigerian Oncology Group to try and grow the field of oncology in Nigeria and try and improve things as far as these perceptions in Nigeria. Thank you.
Thank you very much. Thank you very much, both of you.